If you want to do something about runaway health care costs, the way to control runaway health care costs is to institute prevention and make prevention a major part of this bill. Prevention can mean clinical services like mammograms and colonoscopies and cholesterol screenings. The good news is that most of the bills being considered would make these services much more accessible and affordable. But successful reform also means addressing another aspect of prevention. I'm talking about primary prevention, the kind that keeps people from getting sick in the first place. Evidence suggests that primary prevention should focus on 3 behaviors: physical activity, nutrition, and smoking. But the reality is, whether through personal choice or lack of options, too many Americans are struggling. Today, 2/3 of Americans are overweight or obese, and often more than 20% smoke. Things are even worse for minorities, who often suffer the most from the lack of preventive care. In my state, we have a diabetes epidemic among Native Americans and Hispanics. We're in this crisis today because we've neglected prevention for years. Of the more than $2 trillion we spend on health care each year, only 4 cents of every dollar is invested in prevention. It just doesn't make sense. Studies have shown that primary prevention will not only save lives, it will also save money. In New Mexico, a $10 per person investment in community-based prevention programs would save $88 million annually. Nationally, that translates to more than $16 billion annually. That's a return of $5.60 for every $1 invested. We have solid evidence that we can spend less on health care while saving more lives. So what should we do? Experts say effective prevention must address 3 levels: the individual, the institutional, and the environmental. Individual prevention is about Americans making the right choices for themselves. This means choosing nutritious foods, maintaining an active lifestyle, avoiding excess weight, avoiding smoking, drug abuse, and excessive drinking. Institutional and environmental prevention help individuals stay on the path to a healthy lifestyle. This could mean incentives for physical activity, disincentives for smoking, and nutritional labeling on menus. It could also mean more bike paths and more school gardens. Legislation approved by the HELP Committee would establish a new fund to support these activities. This kind of dedicated, stable funding stream is critical to effectively addressing America's legacy of neglect regarding prevention. The theme we're talking about today is runaway costs. Effective prevention will help control runaway health care costs. We must have major provisions for prevention in this bill.